The rise in eating disorders in kids we saw early in the pandemic isn't going down like doctors hoped it would. In today's Your Healthy Family, I'm looking into why and the help that's available.
I didn't know how to get out of the hole I had dug.
Katie Kittredge has spent the last several years on a journey to get well. She's now in college, but developed an eating disorder when she started high school.
It wasn't this intentional, oh, I'm going out right now to try and starve myself or anything like that. It was truly, I feel out of control, and the only place I feel like I can control right now is food.
Her parents helped her get treatment, and after 2 inpatient stays, Katie was in recovery. Then the pandemic hit.
So that was a really hard time because I think everything that I had looked up to for 4 years kind of seemed like it crashed upon itself. I really struggle with control and perfectionism, and that really is a catalyst for my eating disorder. And I had to make very conscious decisions about, okay, what am I going to do?
And she wasn't alone. Katie was one of many young people across the country who struggled with an eating disorder during the pandemic, a trend doctors hoped would decline as students went back to school and back to their routines. But unfortunately, that hasn't happened. Dr. Elizabeth Wassenaar says more young people are struggling now because many put off treatment during the pandemic, and their symptoms are even more severe than ever.
They're very ill from both their eating disorder and their other mental health concerns, depression, anxiety, OCD, safety concerns, and all of the consequences of it is that if we don't address the mental health concerns of our youth, it's going to impact them for their entire lives.
A recent study by the Journal of the American Medical Association documented a 34% increase in eating disorder diagnoses in young people during the pandemic. That's why the Eating Recovery Center in Denver, where Katie got help, is expanding its support for young people with virtual programs available worldwide.
Now we can break that barrier down so we can actually meet people where they are, in their hometown, in their families.
She's hoping it's a path to stopping what she sees as a dangerous trend.
We know that when people become ill in their adolescence with severe mental illness and they don't get adequate treatment, that they have functional impairments, developmental impairments, they're not able to be a part of society.
And Katie wants anyone struggling to know, no matter where they are, help is close by, and your life can be changed too.
What used to be a huge part of my life, which was my eating disorder, has now become really minuscule, and it's not something that I'm constantly thinking about.
Now, that doctor also says she expects more young people will need help this coming year and encourages parents to check on their kids if they suddenly change eating habits, start working out a lot, or are pulling back from hobbies or relationships. We have more information on how to get help online at fox4now.com/yourhealthyfamily. For Your Healthy Family, I'm Lisa Greenberg.